Hi, welcome back. And we've been talking today with Nancy and Sharron. We've been talking about the Free Women's Health Forum that's set for September 29th.
Yes.
28 days, not many days left, ladies, to get this all put together.
It's been a flurry. We're very fortunate, all the houses, to have such wonderful volunteers come in, and we're getting ready to start putting gift bags together, and we're expecting over 300 this year. So
that's wonderful.
Yeah,
that's wonderful. And for those that may not know, Baxter Regional Medical Center has 4 community houses, we call them. And I'm going to go down my list, and I have to do them in this order. Okay, we've got the Pites Cancer Support House. We've got the Rappel Diabetes Learning Center, the Mruk Family Center on Aging, and the Schliemann Center for Women's Health Education. These 4 houses are here for all of the Twin Lakes area and beyond that we serve. We have actually 14 counties that tend to come to Mountain Home and to Baxter Regional and to the support houses. So each house individually offers something in those categories, all of which are free.
They are.
Classes, all sorts of things. And Sharron, you've got some lunch and learns, I know, at the Schliemann Center. What have you got coming up?
We have coming up in September, on September 12th, Dr. Matt Wilson is going to talk about varicose veins. The title of that lunch and learn program, which is at noon, is Getting a Leg Up on Varicose Veins.
Oh, I love that.
And the lunch and learn programs are always at noon. If you want lunch, it's $7. You don't have to get lunch. If you don't get lunch, then there's no charge. Also in September, we have Dr. Chris Bryant, who's a oncologist, and he's going to talk about gynecologic cancer, and that's going to be September 21st.
My goodness.
And also in September, we're starting a new walking group called the Healthy Hearts Walking Group, and that's going to meet every Monday, Wednesday, and Friday at 8:30 in the morning.
Oh, how wonderful. And then where are you going to walk? Have you got a route?
I have a route back in the little neighborhood next to the Schliemann Center. There's not a lot of traffic back there. And I've got a mile route mapped out, but this is for people to go at their own pace. So several ladies have said they wish they had somebody to walk with.
It's a great idea.
And so they can go the full mile. Some of them may want to go another mile. It's just sort of for their own pace and
getting everybody out there to get healthier.
Just to get moving. Yeah.
Yeah, I keep looking at the treadmill and saying, winter's coming, you're going to just put on more weight. Get going on that treadmill now.
The treadmills are great for hanging laundry out.
Oh, my goodness. Anything else in September, lunch and learn wise?
Those are the main things I have. Okay. I have a lot coming up in October too. We're going to be getting out our calendars and everything.
Okay.
So,
all right.
The number to call to sign up for a lunch and learn program is 508-2345.
2345, easy to remember.
Yes.
Yeah. Well, tell us, ladies, some more about the Women's Health Forum. We'd mentioned earlier you've got for heart disease topic Dr. Otis War, a cardiologist who's a remarkable. I mean, that's information there that certainly women will want to pay close attention to.
Well,
number
heart
one
disease
killer.
is the number one killer of women.
And women present with such different symptoms than men. And so Dr. War I'm sure he'll go over some of those symptoms and when you need to go see the doctor, but it's not always that pressure in the chest or chest pain.
Right.
So
might be back pain, I was told.
It can
be back pain.
Sometimes I had one lady she would just get a severe headache in the back of her head. I mean,
really?
Just one of the oddest things. But and sure enough, she would go in and she'd be having a heart attack.
Oh,
so.
be darned.
Yeah, but he's going to talk about that and about the atypical presentations that we see with the women. And then, of course, Corinne with the screenings is going to be very important. I think we kind of neglect those. Or sometimes it's good to know because, our doctors are busy. And if we get to 60 and we know that, we should have this test at 60 years old, it doesn't hurt to say, Dr. So-and-so, do you think it's maybe time for me to have this test?
Yeah.
And just give them a little reminder once in a while.
We need to be responsible for ourselves and so in our own health care.
That's right. And know that if you haven't had that colonoscopy in 10 years or 5 years and it's due, you might say, it's time for that. Nice reminder there, Dr.
Yeah, thanks.
Oh, goodness.
And Corinne Heiser, She's a nurse practitioner.
She is.
Yeah.
She's been a family nurse practitioner for many years. Great speaker.
Yeah.
Great.
Yeah.
Just full of energy and such a delightful person. And so we're really we're just so fortunate for all the professionals that come out and help us to put on these programs. They do it free of charge. You know, they give very
Donate
willingly
their
of their
time.
time. So we're very thankful for that. And our goals in all the houses, you know, is we're trying to make people more proactive and healthier. And, you know, and just try to educate them about their needs and make them more, like you say, responsible for their health care. So.
And really, I know that things are always, new information is always coming through.
Right.
For the various diseases, and a lot of myths needs to be dispelled. And I know that this is a great format for people to come out to something like the Women's Health Forum and just really understand the most current information, the most current facts about how they can stay healthy.
Yes, and we always allow for a question and answer time after the speaker when they finish. And sometimes I think we could fill a whole hour with just questions because we have never ever not had any questions. There's always plenty of questions. So if you just have that question you've just wanted to answer to and been afraid to ask, if you don't want to ask it out loud, you can write it down. We have little note cards on the tables. We'll pick them up and take them up to the speaker, or even a lot of times
little basket.
The speaker will stay for a few minutes afterwards if you need to meet one-on-one with them. So.
Yeah. And I know that has been very beneficial with the various things you've had in the past, Sharron, too, as far as helping women and various programs.
Well, that's a good thing about these programs. I mean, it gives you that access to a healthcare professional who can answer those questions.
And it's literally saved lives.
It has.
We know of a number of people that have benefited tremendously, and it has, in fact, in one or two cases that I can think of immediately, saved people's lives by coming to one of the houses, asking the questions, talking to the professionals, and finding out, gee, you know, I've got those symptoms. Maybe I really should go in and have something checked.
Right.
Only to find that, you were dangerously close to being near the end in many cases. So
and we need to be better. We need to take better care of ourselves and be more aware. And I think as we see healthcare changes, we're going to see a bigger push on more preventive health. And you know, being good stewards of taking care of ourselves. So we're just out there, hopefully, and we try to do it in a fun format.
Yeah,
and,
I love that with the hats.
and just like the Men's Health Forum, it's only ladies in the room with the doctor. So
it's a real comfortable environment for them to ask their questions. They don't have to feel intimidated in any way, shape, or form. Just ask them. It's all just ladies, all just sitting around having lunch, having some fun. Well, tell us again then, this is going to be on Thursday, September 29th.
Right.
And go over the times again as far as people coming in.
It runs from 9 to 2. The speakers actually start at 10, but we have several booths available and screenings available that morning. We do ask that they call and register. They can call us at 508-3880 to register.
3880, okay.
And the main reason for that is because we're providing free lunch and stuff. We want to make sure we have enough food for everyone that attends that day. And then, like I said, if you have a group of ladies from your church or a group that meets on a regular basis, and we've had some call in already, and say, you know, we really like to have an area for 10 people. If you'll just mention that and to ask for Nancy or Bonnie and give us that information, we will try to accommodate that for them this year.
Wonderful. So, get a group together, get your friends, and come on down. We've gone over some of the things just to repeat, so you remember our screenings. There's vision, hearing, the balance testing. Bone density is going to be done on the mobile mammography unit. Okay. Blood pressure checks and AccuCheck for the blood sugars.
And then the skin cancer screenings.
And the skin
for the
that Dr. Nice is doing. Yes.
So.
How nice of him to donate his time. That's
Definitely.
great. Especially at the end of summer, coming up at the end of summer. Find out, did I spend maybe a little bit too much time out there?
Exactly.
Well, ladies, I want to thank you so much for joining us today. That was wonderful. Can't wait for this event to come around. It'll be a lot of fun. So that number again, Nancy?
Is 508-3880.
All right.
And wear your marvelous hat.
Marvelous, yeah, remarkable hats. We're into those.
Yes.
All our remarkable hats. And because prizes will be awarded in different categories for fabulous hats.
That's right.
Okay, so we must have sporting, and we must have.
I'm not sure if they're
sure.
going to do most colorful.
We've got committees working on this.
Yes,
yeah.
we do.
Okay, all right.
That's right.
You'd be surprised at how many people it actually takes to pull a program like this together. And again, I just want to say we're thankful because most of this is done by volunteers.
Volunteers,
Yeah.
yes.
How many volunteers have you got over at the
At our
Mruk
center,
Family Center?
we
and
probably
Aging?
have around 18 that work on a regular basis. And then I have what I call my special project volunteers, and I have about an extra 30 in there
My
and they
goodness.
are so good. They come in and help set up, and I know Sharon has the same. She's got volunteers that pretty
Regina
much
Ellis,
man,
yep.
Regina, all the houses,
Yeah, Jody, yeah.
And I know we're all very thankful for our volunteers and the work that they do.
We couldn't do
Absolutely.
it. We couldn't do it without you.
No, that's for sure.
Not only at the houses, but as the hospital as well. So, well, ladies, thanks again so much for joining us today, and
Thank
don't
you.
miss out 3rd Annual Women's Health Forum. Hats Off to Women, Thursday, September 29th at the Baxter County Fairgrounds, and you need to call 508-3880 to register. Come on down and enjoy the fun. We'll see you next time on BRMC's Healthy Connections.